We started the HurtFit Cares program because we wanted to find a way to give back into the community in which we live and work. Each quarter we choose a charity that we sponsor, and we donate $20 for each new policy that we write in that quarter.
So today we have Raghav with us. We're going to be talking about his new entity, Little Sparks. He's going to tell us a little bit about his family today and what he has going on. It's pretty important work, and obviously Raghav and his wife Meg are close friends. I'm really excited to share with you all today what Raghav has going on his end.
We started Little Sparks Project about a year ago, a little less than a year ago now. So the background of it was my son was born with something called Apert syndrome, which is a pretty rare genetic condition. And so it comes with a whole bunch of medical complexities. But that's when we're in the hospital, we met so many families who were dealing with the emotional stress and toll of having a child that's a little different. But the one thing that my wife and I didn't really recognize is how many of them were dealing with the financial impact of having a child with medical complexities. And you would hear families talk about options of, we might have to put this child up for adoption. We can't afford to bring them home. We can't go visit them when they're in the NICU or in the hospital because we have to work. We can't afford to do all the things that we would normally do. And so ultimately we sat down and we were in a pretty fortunate position to be able to help people. And we reached out to a group of friends of ours, and it was immediate. Everyone wanted to jump on board. So essentially the mission around Little Sparks Project is, we say we want to give the spark back to families. We want to be a spark in people's lives. We want those families that are dealing with a child with medical complexities to not have to deal with the financial burden that comes along with them. And recently we did up the math for our own family. And over the last 10 months, we've spent just over $15,000 in addition to what medical insurance is covering just on Brooks. And I can't imagine that in families that don't live in Boston or near Children's Hospital. So the goal was to give them the financial freedom to be able to take care of their child, to love their child, to do whatever they need to do with that child without having to worry about the financial impact. And so we've helped a bunch of families already, but that's the background. Yeah, so we recently helped a family, and for their privacy, I won't tell too much about the family themselves, but they essentially had their third child, and the third child ended up staying in the NICU for a pretty extensive period of time. And unfortunately, like, what came along with that was childcare for their two children at home, staying in the hospital, staying at a hotel nearby the hospital because they weren't all that close. And fortunately, they were in an area where they didn't have to fly. So that was helpful. But essentially what we heard from them was there's two major struggles. One was lack of emotional support because their families just didn't quite understand what was going on. And number two was the financial burden of their two children at home. So it was, it was never a case where they were saying, we can't take this child home. They were always taking the child home. They were just going to deal with the aftermath of the financial burden that it created because they loved that child. And we wanted to do anything we could to help them. And I remember giving them the phone call after the application came through, and the emotion that just comes over them, but also you. And I had my wife next to me, so like she started crying, which immediately meant I started crying because that's just how it works. But it was the first family we helped. It was absolutely incredible. We've helped a couple since then as well. And now we have a bunch of applications in right now, so we're vetting those and trying to help some more families. And that's the goal, right? Is we will continue to push the fundraising efforts and all that stuff. But most importantly, we want to keep pushing families to say it's okay to say they need help, and it's okay to ask for it sometimes, and we're willing to help them.
As you see these people struggling, do you think there's any changes that need to be made on a social level or even at the healthcare level? What are you seeing that, we're at this point, right? We're talking more than just your fundraising and things like that, but there has to be, I'm assuming there's some massive systemic changes that need to happen to, support these families that are going through this.
Yeah, my goal is not just the fundraising. Our team's goal is not just the fundraising. At least that's what we've discussed, my wife and I mostly. Medical bills are one thing. To not be able to access hospitals or get to hospitals or stay near hospitals with your child because you can't afford it isn't right.
Yeah.
And so there has to be a social change to allow families to be able to do this. And there's a lot of people that are mad at, well, free healthcare is nonsensical and all that stuff. There's like a political angle to this, but realistically, if you're in a situation where your child has to go to the doctors, no one cares about that.
Yeah.
It's how do we make sure that children, we're talking about, like, it's not what we're talking about adults. This is not a political problem. Like, children need to be able to get care, and it shouldn't be about who has money and who doesn't. Just because someone can fly to Boston Children's on a regular basis without having to apply for things and get grants and get funding and all this stuff doesn't mean that the child who can't shouldn't be taken care of at the same place, the same hospital. And that may not be happening as frequently as we think it is, but the amount of families we talked to while we were there, it's a problem, and it's something that I hope we can change. It's something I hope we can fix over time. At first, we're in fundraising to help the families, but over time, I mean, there has to be a larger change. There has to be a bigger mission, and it can't just be about giving some families some support. Thing that I thought was going to be a challenge, the biggest challenge that didn't end up being a problem, was I didn't think anyone would say, yeah, I want to help with that. And it was because I didn't know anyone that had gone through something similar. And now I do. People just don't talk about it as much. But there were so many people that reached out, including you, and so many other people that said, we want to help, right? How do we get involved? How do we make sure that you get all the support you need? You can raise money. We believe in this. Families need help. And that part was a lot easier than expected. So we decided early this year we were going to have a big gala, black tie event to raise as much money as humanly possible for families. And so far we have just over 300 people attending. The goal is to get to 400 people attending. So we have 2 months to go, and I have to add 100 people. So I think we have confidence we'll get there. But the gala is at the State Room in Boston. It's on December 19th. It has a silent auction. It's going to be a really good event. Every dollar is going to go directly to families. So I've been saying for the last couple of months that my wife and I will match every ticket sale that's made. We did that because we decided we were essentially just going to pay for the entire gala out of pocket. And every dollar that's raised, we were going to give directly to families, because that's the intention, right? The intention was to help as many people as possible, and this is the best way to do it. So we didn't want any money going towards a massive event instead of family. So that's the gala. After the gala, there's a lot of things planned. So next year, we're most likely going to attempt to do a 5K or a golf tournament, one of the two in the summer. We'll definitely do another gala type event. But moving forward, what I really want us to start doing is doing more hospital-oriented events to find families. So we're trying to get in front of more hospitals. We're trying to get in front of more childcare providers to make sure that the doctors, the caseworkers, the surgeons that are taking care of these children are aware that there's options out there for them, so they don't have to scour the web or search for things to find out how they can get help. And so over the next couple of years, I think now that we've raised enough money and we've done well with that part, it's how do we get as many families as possible to start applying so we can help them. And I think that's going to be the goal of next year and following year. And then maybe in the long term, the goal is to help with the social component of all of this, right? How do we make sure that this isn't a problem in the future? And we can ensure that there's regulations or rules set up for families that are experiencing things like this, so they don't have to worry about the financial burden and they can focus on their child. So that's kind of the long-term vision. So I think this is where the insurance community has been so helpful, right? I think I've reached out to quite a few people and talked about the gala. I've reached out to quite a few people to talk about sponsorship of the gala. And in turn, in those conversations, I'll also say we're looking for more families to apply. And now we're at a point where we need that. We want that. We want as many as possible so we can help them. I think that's here where the insurance community is so interesting, is because they're insuring a lot of these people, doctors, surgeons, nurses. They know a lot of people. So we've been able to get in front of people that can relay this information to families so families can apply. So I think that's the area where you and others could really help, is communications to doctors, surgeons, and patients in turn, to make sure that we're getting in front of the right people so they can actually get the support they need. To apply for a grant, for funding for your family, we have a website. It's www.littlesparksproject.org. And there's an application section on the website. On the very first page, you'll see application. And if they fill in that application, that serves as applying for a grant. We look at that and make sure there's a true medical diagnosis. We have a nurse that helps us with all of that. And then she'll send out a full application. And generally it takes us a couple of weeks to get back to the family and say, yep, you're approved and here's a check. And we'll call every family that applies to make sure we have a conversation with them. But that's pretty much it. It's a simple process. We don't want them to be fighting over getting money. So we want to make it as easy and seamless as it can be.
But yeah, no, we appreciate your time. Really appreciate the work that you're doing. It's
Well,
awesome.
I appreciate you. I appreciate you doing this for us, the HeartFit Cares program. We appreciate everybody. So thank you so much. This is awesome.